Yeah, good morning everybody, and thanks for the invitation. So I'll be giving you an insight into our experience, hoping to be practical and not to make philosophy about medical tourism. I have just a few minutes, so my opening will be short and to the point. Is medical tourism today in Italy an important reality in terms of volume and income? Unfortunately, no, at least not yet. Could every hospital propose itself in this market? Yes, but with mediocre and slow results. Could medical tourism really grow in the future in Italy? It depends. It depends on the creation of a network. That's the point of today's session. That's the point of Intercare. So just a few words about ourselves. Istituto Auxologico Italiano is a non-profit organization with a focus on biomedical research and with highly specialized hospital treatment. With more than 60 years of research and treatment activity, Istituto Auxologico Italiano is one of the top and widespread facilities in Milan. It offers innovative surgeries and advanced rehabilitation. The collaboration with international hospitals and research centers worldwide has pushed Auxologico at the forefront of the medical tourism in Italy for diagnostic, medical checkup, second opinion service, surgical treatments, medical and rehabilitation recovery. Our numbers: we have 12 locations in Lombardy and Piedmont, 21 research laboratories, more than 200 scientific publications each year, 800 hospital beds, and 1 million patients a year. But I'm pretty sure you will forget this number in a few seconds, so I'd like to focus your kind attention somewhere else. We started back in 2014 what we call our medical tourism program with the wild dream of serving hundreds of international patients. We started from scratch, and we have been steadily growing ever since. Basically, we have tried to learn from our mistakes, and we continually strive to perfect our procedures and protocols. Auxologico was one of the first hospitals in Italy to be at the forefront of medical tourism. About 5 years ago, the International Patient Center was created to assist the foreign patients, designed as a one-stop center that manages the entire patient healthcare process from the beginning to the end. We are accredited with the Medical Tourism Association, the first international USA non-profit association, who organizes yearly updated certificate courses for professionals. The development of medical tourism is a medium-long-term goal. Anyone who believes that creating an international patient program is a walk in the park is in for a rude awakening. It takes time, it requires commitment, passion, and perseverance. So what we did, definitely having created a medical tourism structure has proved useful to the creation of value. By stepping into our patients' shows through surveys and field interview, we listened to their experience and we tried to understand their point of view. We trained our staff to be culturally sensitive. We provide linguistic and cultural mediation service. We identified a medical consultant for each medical team committed to the project in terms of communication skill, second opinion service, availability for Skype conference call, connection with local consultant abroad, etc. We review all our processes for international patients, making them more flexible and accessible. We are easy to contact and quick to respond. We review our medical offer with the creation of all-inclusive medical packages. And at last, a little bit surprisingly, we had the opportunity to experiment our international patient services primarily with the local foreign community, long-term residents and temporary visitors. While we were establishing agreements and contracts and relationships with the mother country abroad, we started to serve the foreign community living in the heart of Milan. It has allowed us to create a tailored healthcare services as well as an outpatient international clinic dedicated to the local community. So, what about Auxologico? How do you face systemic weaknesses about the development of medical tourism in Italy? Auxologico's approach is founded on three main pillars: care networking, care customization, and luxury care. First one, we have managed to go behind this paradigm of isolated specialists doing parts of care to multidisciplinary teams doing personal care. And coordinated care is expensive for the hospital and for the patient. Healthcare is a coordinating team sport. Pre-admission exams, diagnosis tests, surgery, rehabilitation, all within a multidisciplinary approach. Integrated care services means care coordination, time optimization for the patient, clinical connection, and continuity of care. Second pillar, care customization. Healthcare is treating us as averages, not unique individuals, because at the end of the day, the patient is not the same thing as the population who are studied. Our medium-sized hospital network allows us to treat people not as statistics, but dedicate them a personal care service. In a global healthcare arena that we can experiment also in this day here in Intercare, customized care means to dedicate extra time and attention to every patient, be willing to adapt. We strive to go the extra mile. We proudly provide personalized, confidential, and culturally sensitive services. We arrange aftercare with the patient's general practitioner, and we maintain frequent and constant contact with the patient, organizing a detailed follow-up. Third pillar, luxury care. With this expression that I invented this morning, I mean the mix of experienced doctors, cutting-edge technologies such as Da Vinci robot, 3 Tesla MRI, and luxury facilities all located in the heart of the city. In conclusion, I want to talk about what I call the network challenge. Hospitals need to realize that they cannot be internationally competitive without support and collaboration. One hospital cannot solely attract international patients. We need a network that is engaged in co-joint efforts to globally put themselves on the market and build an international reputation. As provider, our core business is to take care of the patients, but in terms of healthcare service. However, to be able to accommodate foreign patients, there is a necessity to create a fusion between travel agencies, insurance companies, political institutions, lodging, transport, and concierge services, accredited facilitators. Today, becoming a medical tourism hospital could sound trendy, but the greatest limit at the moment is the lack of serious partners who are interested in the development of this market. We are so always looking for someone with whom to work in sync to deliver the best quality product. We are looking for a medical facilitator. Quality of service vary a lot significantly from one medical facilitator to another in terms of pre-assessment phase and post-op. We are looking for tour operators who look after all the patient needs. We are looking for insurance company interested in a cost-saving policy. So opportunity is knocking. What are we going to do? That's our part. Thanks.
Thank you, Emanuele. Can we just go back to the previous slides 1 second? So, as I said in the introduction, this is a very complex market. How long did it did it take to establish the international office and to start all this work? You started when doing medical tourism?
So we started 5 years ago, and the first month we were expected to, we set up a website in various languages, and a little bit of marketing, and we were waiting to the door, waiting for hundreds of patients, but the first month it came 0 patients. But every year we increase our numbers, so we strongly believe in a not massive market, but in a customized market. So hard numbers, we want a good increase of numbers. I mean, because we know that every foreign patient needs extra attention to our staff. So okay. It's continually growing, slow growing.
Okay, thank you.